Hello, everyone, and welcome. Thank you so much for joining us today for Real Voices, Real Insights, a discussion on Palsonify. We're glad you could be here. Before we get started, I'd like to quickly review a few housekeeping items to help the program run smoothly. You're welcome to submit questions at any time by typing them into the Q&A as they come up. We'll do our best to address as many questions as possible during the Q&A portion at the end of the program. Please note that the presenters are unable to provide medical advice, so be sure to follow up with your own healthcare provider with any questions related to your personal health or treatment. With that, it's my pleasure to introduce our first speaker, Dr. Jerkins, who will begin today's discussion.
Good morning. So I'm very pleased to present an introduction to PALSONIFY, which is a prescription medication used to treat adults with acromegaly for whom surgery was either not effective or in whom surgery is not an option. So what should I tell my healthcare provider before taking PALSONIFY? You want to tell them about all your medical conditions, including if you have gallbladder problems, if you've had blood sugar problems, because this can affect insulin secretion. So if you've had high or low blood sugars, if you've ever had a problem with a low heart rate, if you are pregnant or plan to become pregnant, because it's not known if PALSONIFY will harm your unborn baby, if you're breastfeeding or plan to breastfeed, because it's not known if PALSONIFY will pass into your breast milk, talk to your healthcare provider about the best way to feed your baby if you take PALSONIFY. Healthcare provider needs to know all the medications you take. Sometimes when you have a disorder like acromegaly, you're on a ton of them, but you need to bring all of them to your appointment or a list because PALSONIFY can interfere the way other medicines work. And that includes vitamins and herbal supplements and anything you might take over the counter. Also, tell your healthcare provider if you take any medicines that can slow your heart rate and what medicines you take. And make sure you keep that list with you every time you come in and that you edit it when you see your other healthcare providers. So, what are the possible side effects of PALSONIFY? PALSONIFY can cause some serious side effects, including GI problems and gallbladder. Because your gallbladder empties more slowly, it can cause you to have problems with gallbladder building up sludge or stones. So you tell your healthcare provider if you have a pain in the upper right area of your abdomen or stomach, a sudden pain in your right shoulder, a pain between your shoulder blades, yellowing of your skin or the whites of your eyes, or pale bowel movements. It may also change hormone levels, potentially causing either a high blood sugar, which is called hyperglycemia, including diabetes, or low blood sugar, hypoglycemia. So tell your healthcare provider if you have had problems with high or low blood sugar, and your healthcare provider will check your blood sugar when you start taking PALSONIFY or when your dose is changed. Heart problems, tell your healthcare provider if you have a history of palpitations or slow heart rate or your heart doesn't beat normally. Thyroid problems, PALSONIFY may keep your thyroid from releasing thyroid hormones, leading to hypothyroidism. So your thyroid functions may be checked periodically during your treatment with PALSONIFY. PALSONIFY may also cause malabsorption, which can give you loose stools, and it comes because you don't absorb the fat in your diet very well. So if you have any new or worsening symptoms, including fatty stools that are hard to clean off or float on the water in the toilet, changes in the color of your stools, abdominal bloating, especially right after a meal, or weight loss. And then lastly, you can have low B12 levels in your blood. Your healthcare provider may check your B12 levels during treatment with PALSONIFY. So the most common side effects of PALSONIFY include diarrhea, pain in your stomach, nausea, vomiting, decreased appetite, slow heart rate, high blood sugar levels, and irregular heartbeat. For all possible side effects of PALSONIFY, you can ask your healthcare provider or pharmacist, and we want you and encourage you to report any side effects to Crinetics Pharmaceuticals at this number or to the FDA. And we always do this with new drugs because obviously we don't have millions of people when we launch a drug. So we want to make sure if you have something we didn't see that we evaluate it completely. My name is Terri Jerkins, and I'm an endocrinologist, and I practice at Midstate Endocrine Associates in Nashville, Tennessee, where I have a great interest in pituitary disorders, including acromegaly. I am a speaker and principal investigator for Crinetics Pharmaceuticals and for Novo Nordisk in their studies. So the slide presentation is sponsored by Crinetics Pharmaceuticals. I'm being paid by Crinetics to share this information today. I'm not able to answer any medical questions related to your personal health. And please follow up with your own doctor if you have any questions about PALSONIFY and what we discussed today related to your health or treatment options. So this provider presentation is to understand acromegaly and the treatment with PALSONIFY as a treatment of acromegaly, and to also give you options about resources to support it. And then when we finish with my part, I'm going to introduce you to Ashleigh, and she's a person with acromegaly who's taking PALSONIFY. Acromegaly is a rare chronic disease. It occurs when the body makes too much growth hormone and another hormone called insulin-like growth factor. This is usually due to a non-cancerous tumor in a very small gland underneath the brain called the pituitary gland. You make excess growth hormone and IGF, and it results in your body growing in abnormal ways after your bone plates have closed, so it can change your appearance. You can get changes, particularly in your facial appearance. You will get oily skin, marked increase in sweating. That's sometimes the most troublesome side effect. Numbness or tingling in your hands. You can have headaches. You can have issues with your vision. You can have hormonal abnormalities in all the other pituitary hormones potentially. Metabolically, it can give you diabetes because growth hormone makes insulin not work right. Gastrointestinal, it can give you polyps or growths in your colon. Reproductive, if you're female, it will cause irregularities in your monthly cycle, or it can even make your period stop. And if you're male, you can have trouble getting and keeping an erection. Cardiovascular, it causes high blood pressure and heart conditions. Respiratory, it can cause issues with your breathing. And skeletal, it gives you extra bone growth, but it's mainly in what we call the acrobones, the ones that don't grow when you're a teenager. So that gives you enlarged hands and feet, and it gives you joint pain and arthritis. And because this is very subtle, a lot of times you aren't diagnosed immediately. And this, from the symptom onset to the median time to diagnosis is 4.5 to 5 years, but a lot of people are 15 plus years before they get diagnosed because this isn't a tumor you can see easily. And uncontrolled acromegaly is debilitating. It impacts a person physically, emotionally, and functionality. It's just something we want to catch as quickly as possible. So why does it matter? Without treatment, acromegaly can lead to serious health problems and even shorten their patient's life. With treatment, patients can have similar lifespans to the general population. Treatment may involve surgery, medication, or radiation therapy. The goals of therapy for people with acromegaly include bringing IGF-1 and growth hormone levels back to a normal range. We want to prevent and control symptoms and other health conditions. We want to help people live longer with treatment. We want to improve their symptoms, and we want to limit the growth of the pituitary tumor. So what is PALSONIFY? Paltusotine. PALSONIFY is a prescription drug approved by the FDA in September of 2025, used to treat adults with acromegaly for whom surgery was not effective or surgery is not an option. The first and only once daily oral medication that could be used as your first drug treatment if your doctor thinks that PALSONIFY is right for you. Specifically, it's made as an oral medication so your body can absorb it effectively. This helps it work continuously in your system from one dose to the next, so there's no drop in the levels of the drug that you might feel. In a study, PALSONIFY helped people maintain progress in treating their disease. 83% of people taking PALSONIFY maintained normal IGF levels compared to just 4% of people who weren't taking it. Those patients were given a placebo, which is a drug that is packaged to look like the study drug, but in fact does not contain any medication. The average IGF through the study stayed in the normal range for people that were taking PALSONIFY. So it also helped to keep people in control. 96% of the people taking PALSONIFY who had normal IGF-1 levels at the end of the study were still in control over a year later. So out of 23 people who achieved IGF normal levels at the end of a 36-week study and attended a follow-up visit at week 60, 22 of them, which is 96%, had normal IGF levels at week 60. In another study, PALSONIFY helped to reduce IGF levels in as little as 2 to 4 weeks. 56% of patients taking PALSONIFY got their IGF level down to normal compared to just 5% of people who didn't take PALSONIFY, so those that were on placebo. The average change from baseline is showed on the graph. It helped to reduce the IGF levels in as little as 2 to 4 weeks, and 93% of the people taking PALSONIFY experienced reductions in their IGF-1 levels. PALSONIFY also helped people improve their symptoms. In addition to the main study measurement, which was IGF-1 and certain other hormonal parameters, acromegaly symptoms were also measured. And they were measured based on the acromegaly symptom diary, and it tracked headache, joint pain, sweating, fatigue, leg weakness, swelling, and numbness and tingling. And in one study, most people taking PALSONIFY experienced significant improvement in the severity of those symptoms. PALSONIFY side effects, most side effects were mild to moderate, and most of them were stomach related, and most people resolved without stopping the drug. People who were switching from injections experienced diarrhea in 23%, nausea in 13%, loss of appetite in 10%, fluttering or racing heartbeat in 7%, and then stomach bug-like symptoms, gastroenteritis, 7%. People new to the treatment or restarting after a break from another medication experienced diarrhea, 33%, stomach pain or discomfort, 19%, nausea, 9%, slow heart rate, bradycardia, and high blood sugar, 7%. People stick with this drug. At the end of the 36-week clinical trial, more than 90% of people chose to take PALSONIFY instead of going back to injections. And in the same clinical study, almost everyone taking PALSONIFY stayed on track with their treatment. The recommended dose is 40 milligrams once a day. It comes in 20 milligram tablets and 30 milligram tablets. So you will start on 2 of the 20 milligram tablets taken together. After you've been on the 40 milligram once daily for 2 to 4 weeks, if your IGF has not been acceptably reduced, then you can adjust your dose to 60 milligrams once daily, which will be 2 of the 30 milligram tablets. PALSONIFY is designed to work with your body. It's made specifically to be a once daily oral treatment that's absorbed efficiently through your digestive system, unlike injections. It's designed to stay active in your body for over 24 hours and helps maintain a steady level of medicine throughout the day with just one daily dose. It is important to take it on an empty stomach with just water because that helps your body absorb it fully. If you have food or other things in your stomach, it'll keep you from being able to absorb it as well. So it's very important to take it with water on an empty stomach, but you have to wait at least 6 hours. After taking it, you wait at least 1 hour before eating or drinking anything other than water. And you take PALSONIFY at the same time every day to get you in the rhythm of this because that is a little change in activity for most people. So in summary, PALSONIFY is a once daily oral medication used to treat adults with acromegaly for whom surgery was not effective or surgery is not an option. The common side effects include diarrhea, stomach pain or discomfort, nausea, vomiting, loss of appetite, racing or fluttering heartbeat, stomach bug-like symptoms, slow heart rate, and high blood sugar. In the clinical trials, PALSONIFY helped people to lower or maintain IGF levels, reduce IGF-1 levels in 2 to 4 weeks, reduce the severity of acromegaly symptoms, and at the end of the 36-week clinical study, more than 90% of patients chose to take PALSONIFY instead of going back to their injections. So people always worry about the cost of things. CrinetiCARE is an agency and program that's designed to help access and to help eligible patients start and stay on it. It allows you to have, with a prescription from your doctor, an investigation of your insurance benefits, prior authorization, appeals if they are needed to get it, and financial support for those who qualify, quick start, copay assistance, and patient assistance programs. They also have nurse educators that are on call all the time to help you and make sure you understand if you have any side effects or any issues while taking it. Thank you for your attention today. And now Ashleigh will share their personal journey with acromegaly and their experience taking PALSONIFY.
Hello, everyone. My name is Ashley, and I'm so happy to be here today. I'm 38 years old, and I live in Waynesboro, Tennessee. My husband and I fell in love as teenagers, and we've been together ever since. We have a son who is 12 years old, and we love being there cheering him on at his baseball games and golf tournaments. I'm being compensated by CrinetiCARE to share my personal experience with PALSONIFY. This is my personal experience with PALSONIFY, and your experience may be different from mine. My hope is that as I share my story, you'll see you're not alone in your acromegaly journey and you'll feel encouraged to advocate for yourself. When I was in high school, I was diagnosed with PCOS. Since there is no cure for this condition, I just learned how to deal with my symptoms, including headaches, weight gain, and high blood sugar. Over the next couple of years, I would sometimes wake up drenched in sweat, or I would have a terrible headache that would last for days and sometimes be accompanied by intense sinus pressure. That didn't seem normal to me, and I tried talking to a couple different doctors about it, but they all brushed it off as seasonal allergies. I often felt extremely anxious about my condition and symptoms. It got so bad that I eventually avoided leaving my house. In 2011, when I was 24, I noticed I had fluid leaking from my breasts and that they were very tender and sore. I hadn't had a menstrual cycle in 7 years and I wasn't pregnant, so I grew very alarmed. I made an appointment with my doctor, and she told me that she was going to send me to an endocrinologist because my prolactin level was outside of normal range. As soon as I went to the endocrinologist, she ordered blood work and she said to me, "I want an MRI of your brain." By this time, I was married, and I remember turning to my husband and saying, "That woman is crazy. There's nothing wrong with my brain. I mean, who would think that there is something wrong with my brain when my breasts are tender and sore?" I almost didn't go through with the imaging appointment, but I'm glad I did. Through the MRI, they found a tumor on my pituitary gland. My doctors explained that the tumor was causing me to produce too much insulin-like growth factor, or IGF-1, and that it was likely causing my symptoms such as the headaches and excessive sweating. As strange as it seems, my first emotion when I heard about the tumor was relief. I was at lunch with my girlfriend when I got the call from my doctor, and my friend said to me, "How are you not terrified?" And I told her that I was just so relieved to have an answer after so many years of questions. Things moved quickly once my endocrinologist confirmed my acromegaly diagnosis. In 2011, I was scheduled for surgery to remove the tumor. Only after realizing I was facing brain surgery did I realize was I able to wrap my head around how serious this condition was. My family and friends were my anchors as I went through surgery, and I leaned heavily on my endocrinologist for information about acromegaly. I did a few internet searches, but still nothing seemed as thorough as the information I was receiving from my doctor. Still, despite understanding the clinical aspects of the disease and how it impacted my body, I felt like I was missing something. I wanted to hear from other people who lived with acromegaly. I craved the connection of talking to someone who would nod as I talked about my experience and say, "I know exactly what you're talking about." I thought my symptoms would go away after surgery, but when some symptoms continued, I realized I might need long-term symptom management. My endocrinologist and I discussed treatment options, and I started on a monthly injection to manage my IGF-1 levels. Unfortunately, getting the injections was difficult for me. The logistics of getting the injections were tricky, from picking up the medication at a pharmacy to tracking them through shipping. The needles for the injections were also intimidating. After the injection, I would have a bump on my back that would be red and sore for several days. My blood sugar levels would swing for a few days, and I would have headaches. I also dealt with gastrointestinal side effects, which I still deal with on my current treatment. I struggled with fatigue, and I also got bad headaches right before my next injection was due. In 2012, I was elated to learn that I was pregnant, despite the fact that my menstrual cycle had never returned. My endocrinologist told me that I must have ovulated while my hormones were getting back into the normal range, and that I had gotten pregnant before my period ever got a chance to come back. At my doctor's recommendation, I stopped the injections and focused on welcoming this child into our family. When my son was born in 2013, I was so thankful and full of joy that I was able to have a baby after so many years of not having a menstrual cycle. I partnered with my doctor after my son was born to determine when to start the injections back. Being a young mother with a baby and experiencing all the same logistical hurdles and side effects as before was extremely difficult. Emotionally, I didn't feel like a present mom, even though I was with my son constantly. As my son grew and got involved in sports, I would sometimes have joint pain, leg weakness from the night before a baseball game from sitting on the bleachers. I continued on with treatment because being on some treatment was better than not having any treatment at all. But my acromegaly was like a fourth member of the family. I tried another injection, but my experience was not much different from the first one. One year, my husband and I took our son on a special road trip to a theme park. I had to have a nurse come to my house at 5 o'clock in the morning just to give me my injection before we left. Sitting in the car for the 12-hour drive aggravated my usual back pain from the injection. Walking around the park with my family was painful, and I was absolutely wiped out by the end of the day. All the memories my family was looking forward to making were colored by my acromegaly symptoms and side effects of my treatment. In 2021, I went to a regular appointment with my endocrinologist. She knew all about my side effects and the challenges I experienced trying to get my injections. And she said to me, "Ashleigh, there's a clinical trial for a daily oral medication instead of a monthly injection, and I think you would be a good candidate." We had a conversation about the possible risks and benefits of trying a new treatment. And after 10 years of treating my acromegaly with injectables, I was scared to try something new. I was scared it might be even less effective than my current treatment. I decided not to pursue trial participation at that time. I was too worried that I would stop a treatment that was keeping my IGF-1 levels in check and start a treatment that might not show the same results. Since I was already experiencing such bad side effects with the injections, I was concerned that I would be even more tired and sick with a different treatment. Furthermore, while I was in the study, I would need to travel to my doctor's office frequently to have labs drawn to see how effective the treatment was being for me, which would be a significant time investment. My doctor understood my concerns and she didn't push me. She reminded me that it was an option that we could talk about if and when I was ready. When I went home, I continued to think about the option of a new treatment. I remember eventually thinking that if my participation in the clinical trial could benefit the acromegaly community, that it would be a win, even if the treatment didn't work the way I hoped it would. By the time my next appointment rolled around, I had decided I was ready to try something new. The idea of having a medication that was a pill instead of an injection was very appealing. I was hopeful that another treatment would work better for me and my lifestyle. My doctor helped me enroll in the study, so I started taking PALSONIFY before it was approved by the FDA. I was grateful to my mom, husband, and family, and a couple close friends that have been with me through my journey. They helped keep my household running when I went back and forth to the doctor, and my brother even rode with me the 100 miles to my doctor's office so I wouldn't have to make the trip alone. As my system adjusted to PALSONIFY, I was thrilled to have less fatigue and fewer headaches. For the first time, I didn't shift around on the bleachers because of joint pain when I went to my son's baseball games. I still had some fatigue when I got home, but I had less joint pain the next morning. My doctor monitored my labs to make sure that my IGF-1 levels stayed in the normal range. Taking daily pills first thing in the morning was easy for me to fit into my day. I have a little routine where I take my other medications, walk the dog, take my PALSONIFY dose, wait an hour to eat, and then start the rest of my day. This works well for me and helps ensure that I take my medication every day. When I first started PALSONIFY, I had a little bit of stomach pain, diarrhea, and nausea. Those side effects have mostly gone away since the first few doses, but if they show up, they're usually mild for me. I also continue to manage my high blood sugar with my doctor. And other side effects may include, but are not limited to, decreased appetite, slow heart rate, and irregular heartbeat. Our family went back to that theme park in 2024, and I was able to pack my medication and go. I walked around without noticing any joint pain or leg weakness. It was so nice to enjoy time with my family without thinking about acromegaly. When PALSONIFY was approved by the FDA in 2025, I decided to stay with my therapy on PALSONIFY. I've been taking PALSONIFY since I was a study participant. My doctor continues to check my IGF-1 levels every 3 months to check that PALSONIFY is still working for me. I'm so glad I trusted my doctor when she suggested I try PALSONIFY. I feel like I spend less time managing my acromegaly symptoms or treatment side effects, and that frees me up to spend more time with my family. Because I feel like my acromegaly is well managed, I'm beginning to think outside of living with a chronic illness, and I'm starting to make goals. Keep in mind, this is my experience. Others' experience may be different. People sometimes ask me what I wish I had known when I started my acromegaly journey. I was fortunate to have a doctor who taught me how to advocate for myself. I didn't realize when I was younger that it was okay to say, "Are there any other treatments we can try?" My doctor started that conversation for me. If you or a loved one have acromegaly and you're unhappy with your treatment plan, don't hesitate to advocate for yourself. Talk to your doctor about what options are available to you and how best to support you through your acromegaly journey. Thanks for your time today. We'll be happy to answer some of your questions.
Thank you so much, Ashleigh and Dr. Jerkins. We do have some questions that have come through in the chat. Let me go ahead and start off with the first one. The first one is for you, Dr. Jerkins. Um, and that is, what are the expected benefits of PALSONIFY?
Well, Palsonify is a prescription medication used to treat patients who are adults with acromegaly and for whom surgery either wasn't effective or surgery was not an option. So it's once daily oral treatment. In studies, it's been shown to help manage uh, both the IGF-1 and growth hormone levels, but particularly IGF-1. And that is part of what we tell you when we say your acromegaly is controlled. People who take Palsonify experience a reduction in the severity of common acromegaly symptoms based on the Acromegaly Symptom Diary, which was reviewed as the ASD.
Thank you, Dr. Jerkins. Um, Next up, we do have a question for you, Ashleigh, for just a little bit about your background. Do you remember what questions you had for your doctor when you first learned about your diagnosis?
I had a couple questions. I remember my first was, what is my pituitary gland and what does it do? I also remember asking, will they remove all the tumor and will it come back? My doctor took time to answer my questions and alleviate some of my concerns.
Thank you so much. And we have another one for you as well that came through. What did you consider while deciding to switch to PALSONIFY?
I had a conversation with my doctor about the possible risks and benefits of trying PALSONIFY. It was important to me to keep my IGF-1 levels between normal range and to learn what the common side effects were. I was pleased that PALSONIFY was an oral medication instead of an injection. I felt like that could work well for me.
Thank you so much. And everyone, please keep adding your questions into the Q&A. I know there are a few more listed, so let's go ahead and switch over to Dr. Jerkins. Someone mentioned in the chat, I'm just learning about my diagnosis. Do you have any tips on prepping for a doctor's appointment? Are there any questions you think are helpful to ask?
I would strongly recommend that you sit down and make a list of your questions before you go in, and that you also bring note paper, or I've even had people bring little personal tape recorders so that you can get exactly clear what we are telling you, and then go back and listen to it if you have questions. When you don't bring those and you are dealing with the fear and dread of being told you've got something like this, you will forget to ask anything. So I always tell people that when they're leaving and they have access to my email so they can come back around and ask me more. But I would bring that notepad every time you go, because this is not a static situation. We're going to be moving things around until we get you where we want you.
Thank you so much. And another question here for you, Dr. Jerkins. What is a normal IGF-1 level?
Well, it varies on different ranges, but it would be in the range of somebody who does not have acromegaly. So we are going to put you back in what's normal. So some assays it's one level and some it's another. I always give patients a copy so that they can, if they have to move or change to a different doctor, they can take that with them.
Thank you so much. And I know we are running close on time. So last question that we have is for you, Ashleigh. Someone asked, what is life like on PALSONIFY?
Everyone's experience on Palsonify is different, but it works well for me, and I'm happy I switched. It helped keep my IGF-1 levels in normal range and helped with my acromegaly symptoms, like fatigue and joint pain. I take 2 pills in the morning when I wake up, then I walk my dog and eat an hour after taking Palsonify. My doctor and I continue monitoring my acromegaly symptoms, and we're both pleased with the way that it's working for me.
Amazing. Thank you so much. And thank you so much for everyone that put questions in the chat. We really appreciate it. And thank you so much for joining the webinar today. If there are any questions or any feedback, please feel free to put that in the survey that will come out after the webinar has closed. Thank you so much, everyone.